Now, Plans for Good Health, brought to you exclusively by UnitedHealthcare.
The COVID-19 pandemic has disrupted our way of life in recent months. Stay-at-home orders, wearing masks, and social distancing measures have created a new normal. And all of us have put activities on hold to reduce the spread of this virus. But one activity that should not be put on hold is your child's annual doctor's visit. Here to offer some advice on vaccinations in today's Plans for Good Health, exclusively by UnitedHealthcare. Please help me welcome back Dr. Keven Stephens, the Chief Medical Officer for UnitedHealthcare of the MidSouth. Welcome back, Doctor.
Thank you for inviting me. This is great. Wonderful. Excellent show.
Thank you so much for coming on. We appreciate you. Now, let's talk about these vaccinations. I just got one. I'll tell you about it in a little bit. But before we talk about that, what homework should families be doing before they get their child vaccinated?
But you need to know when and what and where and how and why. I mean, so you need to really understand vaccines are really the latest and the best technology we have. And what that is, they give a crippled virus, a viral particle, and in your body, it doesn't harm the body because it's crippled. It can't do anything, but your body will gain and get immune to it. And then that way, when you come in contact with it, your body already has immunity and you're good. So that's the modern technology that you got to have.
It's important to do your research. Now, I've done my research. I've made the appointment with the doctor. I get to the doctor. What should families ask their child's doctor once they get there?
Well, first, what vaccines are indicated, when the next one is indicated, what side effects can they look at, what they need to be cognizant of, and how do they know if it's working or not, and those type of questions so they can learn more about the effectiveness of these vaccines.
Very powerful there. Now, I recently just got a vaccination. I got a flu shot actually on Great Day, Louisiana. But it's interesting because you're seeing the amount of people getting vaccinated, especially in children, decline, right?
Yeah, I mean, the state agencies are reporting a 30 to 40% reduction in vaccines. If you compare this time this year versus this time last year, there's a significant reduction in the number of vaccines that are being given.
Why is that?
Well, I think a lot of it is fear. People are a little nervous and uptight about going to the doctor's office and being exposed to the coronavirus. And so we have been quarantined to some degree and isolated. Schools are not in. The kids are learning distant learning. And so a lot of people have apprehension about getting out and getting those necessary things. But this is one that you absolutely need to get. You don't want to get too far behind. And you want to make sure that your children are immunized, because if they come in contact with this virus, these viruses like tetanus and so forth, because if you stay home and play in the backyard, get stuck by a nail, a rustic nail in the yard, then tetanus and all those things can occur, and it can be very problematic.
I'm glad that you said that because, for some parents out there, they may be saying, I don't need to get my child vaccinated this year because they're going to be doing school at home. But whether you're playing outside, you go see a friend, you take them to the grocery store, they can be exposed to whatever is in the air. So it's important to get them vaccinated. Now, what age should we start getting our children vaccinated?
Well, in fact, you should start when you're pregnant. I mean, there are vaccines like hepatitis B for women when they're pregnant. And then right at birth, there are vaccines that you should get. And there's a whole list almost every year along the way up until your age. I mean, you look to be maybe 14 and 15. I don't know how old you are.
Please, yes, thank you. It's the lighting. It's the lighting.
Maybe 18. All right.
21.
But even to your 60s and so forth, the shingles vaccine and pneumococcal so forth, and the elderly, all of them are certainly very much needed. So you need to discuss the common side effects, such as you can have a skin rash, a local infection. Sometimes kids have a little fever and they feel a little bad and those kind of things. So you should know exactly what you can expect and how long and what time period it can happen so that you can keep your child healthy.
And you see right here, of course, know that there are side effects. Every child reacts to things differently. And I also like to remind people to bring a copy of their immunization record so that you can keep up to date with it.
Yes, That is so important. Not only bring it home, but put it in your safe with your important papers because your children will need it. You know, if you move somewhere else, if something happens, you got to have the record. Louisiana has a registry, which is great. But in the event you move somewhere else or go to a foreign country, whatever you may do, you need to have those records because that can make a huge difference in their
It
lives.
is very important, my friends. You know what's also important? Their website. If you want more information about anything we talked about today, go ahead and visit their website, uhc.com.